Thank you, Mark. I really appreciate your advocacy in the face of the tragedy that your family's faced. And I'm really sorry for what you went through with your family. It's really awful. So I think it's so important what you said, that we need to educate physicians. So with that, I'm going to ask the committee if they have questions for our speakers. I'm looking for like your little, when you put your hand up.
Aaron Bell has a question.
Thank you. Thank you all for your words today and your experiences, and for sharing that with us. It's so important to the work we're doing. I had a question for all of you, but in your experiences, especially those of you who are in the clinical community, what in your minds would be the best way to educate and bring training to practicing clinicians? There's, we can perhaps talk about changes at the medical school training and nursing school training, but what needs to happen in the field, in your opinion? What would be the best way to do that?
Well, if I may, we've actually are right now developing, we've done a virtual classroom because we do a lot of residency education. So we just did a big training for Kaiser Family Health Services residents, and we're planning one for residents at UCLA Harbor. So we've actually created a virtual classroom, a virtual tour to tour some of the contaminated sites. And I think that is one of the things that we're doing that. And so our trainings are this combination of, here's some basic science and clinical information that you will need. Here's some of the exposure, and then here's the advocacy tools that you're going to need. So, we do popular education. So we are actually integrating, using popular education tools. We have a tool called a body map, which is, based on the old game Operation, where a series of body images come up and we're able to track, well, this chemical, PFAS, will impact this system, the endocrine system, this way. And so we developed it for communities, and when the physicians saw it, they're like, we love this, right? So we're using that with medical students. So we have found ways to be able to integrate the concepts of popular education, but the data that we need, like, material safety data sheets, because you can't really dispute the science there. Really important tools as well. But having, I've been sort of researching all of the research you're all doing, like how do we synthesize that for them and have them ready? And then the most important part is, where is this happening where I might see patients, so that they are thinking, you know what, I actually might be seeing patients who are being impacted by this. Yeah, I'll stop there.
Can I ask you one question, Martha, too? Have you reached out to like Kaiser Permanente and the big healthcare organizations to actually get at practicing physicians? Yes,
we usually have maybe 4 or 5 of the residency trainers with them, and yes, we are trying to do more of that, so that we're trying to develop a partnership actually with community clinics, because we think it's important to get to the safety net providers, because that's where there's a deeper understanding of the interplay between environmental justice and health disparities, and so they need to understand where they live.
Great, thank you. Chris, I see you have your hand up.
I'd also like to add in on that, if that's okay.
Sorry, Liz. Yeah, go ahead.
Yeah, I just want to add in on that point of geographical locations of our addresses. I know as a woman, I am asked, as many of you are, when my last menstrual cycle was, no matter how old I am, and even though it's completely irrelevant to the point of my doctor's appointment. So why can't we just have a questionnaire that says, hey, did you know you live in a contaminated area from PFAS? Did you live there before 2016? Just to have that as a standard question on everybody's form in El Paso County to get started. I mean, I think that's a pretty reasonable thing. And then some fact sheets to go along with that for our healthcare providers.
Okay, thanks, Liz. Chris, you have a question?
Sure, thanks. I have a question for Martha. You talk about a broad range of contaminants, and some protocols for how physicians need to get involved. Do you see PFAS as being a unique guidance in that respect, or is the guidance general and the chemicals are specific? I'm trying to figure out how we might approach this so you don't have to have a guidance for PFAS and a guidance for lead and a guidance for arsenic and a guidance for, all the different chemicals, because I think you could quickly get overwhelmed with a patient in terms of all the potential exposures. So could you speak to that?
Well, what we often talk about is the cumulative exposures. And in California, a lot of our policy efforts are actually about getting to these cumulative exposures. And so I think the research community needs to start looking at, synergistic effects and cumulative effects of multiple exposures, because there isn't a lot of information for us to give. Again, place matters, right? And I think Liz said it, right? Why aren't they asking where you live? Or why aren't we doing, as a matter of standard practice, doing an environmental health assessment that incorporates where you live, work, and play?
Thank you.
Thank you, Martha. Tamara, do you have your hand up for a question?
Yes, thanks, Beth. This is also a question for Martha, but also for others that presented. Martha, you mentioned that we need a stronger partnership between scientists and physicians. And I kind of wanted to see if you could speak a little bit more to what that type of partnership might look like. What would you recommend? I think the point that, for example, Liz just raised is an important point around, in practice, like what if a physician actually had like a checklist or something about just kind of place-based pieces. But I'm wondering if you meant more than that as far as partnership and what that might look like.
Okay, this is my wish list of things that we've just started to grow as an organization and have the capacity to do. One, we really want data partnerships with community clinics so that we are actually mapping out different diseases that clinics are managing. We would love to have those data partnerships with hospitals. One, because we actually don't have very good environmental health data systems. So right now we're trying to develop that data partnership where, folks, we meet HIPAA requirements, but we could geocode all elevated lead levels, all asthma cases. And that begins to give us a better sense of what's going on in a particular community. But in Southeast LA, I would like for folks to actually have their levels tested, because we know that, there's been shutdowns. And so I think, that, community initiated research is important to answer the questions that communities have. And I think we need lots more, participatory action research. We need a lot of it more driven by community. I think, the other part we really want to see is training partnerships so that residents and interns are actually getting a lot more environmental health education and data so that they are actually looking for those things in their clinics once they get into practice.
Great. Thank you, Martha. Ned, did you have a question?
Yeah, thanks, Beth. I wanted to kind of ask Liz a question. So Martha, I've tried to, influence physicians my whole career, and I've often found the best thing to do is just leave them out and have someone else do it. But that's my prejudice. I really wanted to kind of get an idea about the State Department of Public Health and the local El Paso County Health Department, and how, because I think environmental information on a local area that could influence local physicians is more likely to reside, if you will, in state and local public health departments, where at least it's possible to pursue a relationship with the clinical care, the delivery of care system. And I just wondered how CDPHE was. I know they have an emerging environmental contaminant program, and do you see that public health could be part of the solution for the education of the broader medical care community?
So those are really good points. CDPHE has done a great job defining some things for us and laying terms out. It is a developing program that they have that they've been working really closely with us, and particularly me with. I've been on multiple Zoom meetings with them. And also, they'll present something and say, well, does that make sense to you, in such a way that I can say, no, you have to break it down again. I don't get it. That way, you know, regular people can understand it. I know from personal perspective, trying to find out some data, I've actually called our county coroner to explain some things, because he would actually call me back. And he's a really great guy, Dr. Leon Kelly. And I think if we, you know, has anybody invited the local doctors to meetings? I think that's kind of the first step. They don't know where the table is. They don't even know that they have a chair. They could bring a chair. They have no idea these meetings exist. Maybe we could pinpoint a few people. We do have a CAP, a citizen action panel going on for our health study coming up with the ATSDR. And we've struggled trying to get a doctor to just call us back to get on the 25-person panel. I get it. They're busy. I'm a health insurance broker, as, you know, kind of my day job. They see too many patients. They don't have any time. And then we ask them to do one more thing. What if we brought in UCCS college students as they're working on the pre-med program? What if we brought some of them in and said, hey, did you ever think of an environmental health program, or how can you work with this community and provide some insight? Those are just a few ideas that I have. Let's just invite them, maybe say, please, we need you to go.
Hey, can I comment on that question as well?
Yes.
One thing I like to point out, because this issue has come up all over the country, one thing is the roles of state health departments varies from state to state, and they're funded differently. I mean, I think there's some states, I remember one time I was up in New Hampshire, there's some states that don't even have local health departments. You know, it's all the state entity. And then another problem that you have as far as us that come from Department of Defense contaminated communities is that, you know, they're under, the state health departments are under politics of the governor. One example I get, if people have ever seen the movie Dark Waters and they know about, you know, Parkersburg, West Virginia, people were upset that some people were suing DuPont because DuPont was the biggest employer in that area. And I point out to people at that time, DuPont probably had 90,000 employees worldwide. Right now, the Department of Defense employs 90,000 people just in El Paso County, Colorado. So you're talking, and you know, we were all trying to get Space Corps, and my mother worked at Peterson Air Force Base for 40 years. So, and we've all been in the military. The military's intertwined with our lives. We even have the next generation. You know, Liz's kids are in the military. My nieces are in the military. So it's part of our lives. But the problem is that we have to just figure out a way to do it apolitically. And I think we just have to, you know, start educating physicians and trying and do it from the places where politics can't really seep in. So that's maybe through their credentialing or through their different, you know, medical organizations. I think once we get in entities where they're influenced the politics, us from DOD contaminated communities, there will be some, you know, some push back.
Mark, I think you made some great points going through the professional organizations, and that's very important to do. And, you know, clean water isn't political, right? Everybody wants clean water. So thank you. And I want to thank all of you today. Thank you, Liz. Thank you, Martha and Mark. Thank you for educating us.
Thanks for having us.
Thanks so much, Beth. And I also want to thank each of the speakers on behalf of the committee. Just outstanding information that will help move us forward.